My name is Frederick Omia, and I'm here with my colleague, Mary Kamau. We want to share with you some of the thoughts since Tuesday, from the day of opening up to last evening. And I want to invite Mary to take us through a few of the slides that we prepared, so that we can refresh ourselves. Some of the common threads that we have so far been able to come up with during this GNPHN. Mary.
Good morning, everyone. You can be sure my heart is pounding. Some of us look small but are unfit. So I'll briefly take you through a summary of the last 2 days we've had since we came here on 14th, just to summarize, and we'll encourage you to feel free to give us any resolutions or any recommendations that you clearly would like us to capture in our final report. This is just a summary of what we have been through. We started on 14th with a big welcome from our facilitators who introduced the guests and the organizations in attendance, after which we got our introductory remarks from our GNPHN chair, Linda Smith, and she clearly outlined that public health nursing is clearly not understood, and it is there is limited funding for public health nursing. And after that, Dr. Miriam Mwagoro took us through the conference objectives, highlighting that this is an opportunity for us to present our research, to network, and to also come up with a way forward as far as public health nursing is concerned, wherever we are. Then we went to the main keynote address from our CEO, AMREF, who is also the Universal Health Coverage Co-Chair, Dr. Githinji Gitahi, who highlighted about the increase in non-communicable diseases. He clearly stressed the issue of health systems being a leaking tap, whereas public health nursing can actually close that tap, and it's the main driver for universal health coverage. So nurses, we need to take up more advocacy. We need to be at the forefront in universal health coverage. We need to also strengthen the community health strategy and the community initiatives being the drivers of universal health coverage. After that, we had a panel discussion about human resource for universal health coverage with representatives from Global Health, Workforce Network, AMREF, IntraHealth, JAPIGO, and the Ministry of Health. And the key highlights here were that we need to come up with innovative approaches for affordable financing for medical education. We were given a case in point of what Kenya is doing about offering loans at tertiary level, at college level specifically. During this discussion, it was highlighted about the issue to strengthen pre-service training of health workers versus the post-service. Then about coming up with more opportunities for quality training and how to improve competencies in the nursing fraternity, as well as having curriculums in our training that are responsive to the local needs and the local context. After that, we had the highlight of the day, that was the opening ceremony by His Excellency First Lady Margaret Kenyatta, who was accompanied by various guests, including the Cabinet Secretaries of Health, Professor Magoha, and the Cabinet Secretary of Education, Dr. Cecily Kariuki. So, the other way around, okay, take it the other way around. Then we had a brief remarks from key organizations, after which we had the conference being highlighted as timely, with the fact that it was highlighted that nurses actually provide more than 80% of healthcare, and health has revolved around treatment of disease, but research recommends sustainable solutions beyond care for the sick. So we need more resources, and training programs are required for public health nursing as we strive towards professional excellence and continuation of the same. After that, we had our very special occasion of unveiling of the Global Network of Public Health Nursing Gathering CUTE. As you can see, that was it's now open. It was opened by Her Excellency First Lady Margaret Kenyatta. We were reminded that it symbolizes the gathering of all public health nurses and travels to every conference, staying in that country until it is handed over during the next conference to the next country. So we received it from Denmark, and our chair, Dr. Lucy Bitok, received the torch, so we'll continue lighting that light in Kenya, as Kenya was placed in the global map to join other countries that are promoting public health nursing. So we are going to promote public health nursing in a big way. During the afternoon, we had the Nursing Now campaign. What is it? Why nursing? Why now? And we were informed about the growing global influence of the Nursing Now campaign, where currently we have over 80 countries that have joined this campaign. And the main issue here was about the health labor market, the need versus supply and demand. And looking at the 4 main goals of the Nursing Now campaign is to optimize existing workforce, anticipate future workforce, strengthen individual and institutional capacity, and then strengthen the data, evidence, and knowledge for cost-effective policy decisions. After that, we went for the concurrent sessions after our lunch. And in Jampo 1, here we had the maternal, newborn, and child health practice presentations. Bougainville, we had the sexual and reproductive health rights and gender-based violence presentations, after which we had the Young Nurses Forum, and we are proud of our young nurses. We want to empower them to be more proactive, want to mentor them to take up this nursing profession to the next level. Then we had in Jambo 2 the workshops, starting with the human trafficking workshop on how can we recognize human traffickers or those who have been victims of the same, and how can we appropriately take action promptly. Then we also had clinical health research for Africa in Jambo 2 after that, talking about networking and collaborating for the benefit of research in Africa. We really need to come up and collaborate and continually do research together, not individually doing bits at different individual levels, but it's more powerful when we collaborate and come together. So after that, we had an evening session where we were more informed about the Global Network of Public Health Nursing, with our chair telling us about the organizational structure. Then she introduced the council members and talked about the opportunities available, and our main highlight there was about having an open access research forum and trying also to improve education and practice in nursing. And it was proposed that we are going to launch the Africa chapter of public health nursing during the gala dinner the following day. So let's go to the following day very fast, which was yesterday. We started with a session from the IPAS director on sexual reproductive health rights, talking about policy and advocacy, and talked about the study they have done, the providers as advocates, the needs for advocacy, the role of advocacy, the expressions of power, and the need to increase advocacy as far as these matters are concerned. We then had another session by our TICH chair on empowerment of public health nursing, which was very moving, about the quasi-experimental study that has been done and the barriers to involvement in decision-making. And he highlighted the three main empowerment pathways for us as nurses. One is learning mechanisms. The second is relationship building and networking, whereas the third is vantage positioning, talking about leadership, and he highlighted the various challenges that we have experienced. And then after that, we had a powerful challenge from our ICN president, talking about ICN and the future of public health nursing. We need, as nurses, we were challenged to be more proactive. We need to change, but the change will not come on a silver platter. We must make our voice heard. We must provide constant reminders to relevant offices to include nurses at all levels, in all areas, because we need to work together, we need to collaborate, so the issue of individualism must come to an end in this conference. Amen? Amen. Nurses, we are the linchpin of achieving the SDGs. And so she talked about integrating nurses into the global health agenda. The global three main points there were about having global impact, membership empowerment, and strategic leadership. So strategic leadership is being emphasized again. We need to use our nursing organizations for more advocacy for nurses. We need to have nurses in key leadership positions, because public health care is the key to universal health coverage. We must look at it beyond the health care to health itself for everyone and everywhere. After that, we had the concurrent sessions. In Jumbo 1 here, we had the community health practice talking about research. Bougainville, we had the human resources for health and healthcare financing. Jumbo 2, we had nutrition and child health. After lunch, we went for the other concurrent sessions. Here we continued with community health practice, now talking about policy, education, and research. Bougainville, we had the human resources for health and healthcare financing, now continuing on policy and practice. And then in Jumbo 2, we had mental health and communicable diseases research presentations. And after that, we had a discussion from the African nurses, trying to deliberate on how we are going to form the Africa chapter. And good news, we developed, or we formed, the interim committee, and contributions kicked off. So actually, during the gala dinner, it was highlighted. Now we have the African chapter. We had fun. It was wonderful. People received awards. Congratulations. Enjoy your day. God bless you. Thank you very much.